In this video, we'll be looking at some of the features of pulmonary edema as seen on the chest X-ray and the CT. Let's take a look at this radiograph. We make note that this patient has a pacemaker that indicate an underlying background of cardiac impairment, and assessing the heart size may not be adequate in this case due to the fact that it is an AP projection. This patient has quite typical features of pulmonary edema. First of all, there's generalized peribronchiovascular haziness and aggregation, where it is difficult to delineate the bronchovascular structures towards the hilar region. There is also diffuse veiling-like appearance, as we'll show you what it accounts for on a CT scan later. And there are small parallel lines along the peripheral lung surface which correspond to curly B lines as seen with interstitial edema. So this patient has central pulmonary venous congestion as well as interstitial edema. Note that this patient also has small incidental pleural plaque, which are different from the features of pulmonary edema. Here is the corresponding CT. It is very visible as it dens quite bright and sharp density due to the large amount of plaques along the chest wall. Now, if we go to the coronal images of this CT, we can see what structures are responsible for the predominant perihilar peribronchovascular haziness that is due to the smooth peribronchovascular thickening secondary to pleural fluid buildup. We can see it again here, the peribronchovascular thickening along the fissures. There is also fluid buildup which corresponds to these small curly B lines towards the peripheral lung surface. There is also pleural fluid buildup as demonstrated by these symmetrical bilateral pleural effusions, and these effusions are cardiogenic, so they tend to move more readily in a gravity dependent way, and that's especially if the patient has been lying supine for a while. So also in a gravity dependent distribution, there is interlobular septal thickening, which is greater towards the vessel region and slightly more so in the posterior aspect if the patient has been on their back for a while. So gravity is now on the other side since the patient is lying prone, and as you can see, the pleural fluid has started to redistribute and build up on the interior surface and have the smooth interlobular thickening. In summary, these are some of the typical features of cardiogenic pulmonary edema as seen on a chest X-ray and CT. Thanks for watching.